Hi, my name is Barbie Zabielski, and I'm here today to talk to you about comprehensive sexuality education in Kazakhstan schools. Comprehensive sexuality education, or CSE, includes content on sexual and reproductive health, communication and healthy relationships, human rights, gender roles and gender equality, and gender-based violence, which includes both domestic violence, like spousal abuse, and sexual violence, including rape. The sexual and reproductive health component of CSE includes lessons on reproductive anatomy and physiology, referring to the structures of the male and female reproductive system and how they work. Sexual development, which refers to the changes that take place in those systems over time. Conception and fetal development, which is how babies are made and how they develop in the womb. Birth control, which refers to methods that enable a person to prevent pregnancy until pregnancy is wanted. Sexually transmitted infections, which are infections that are spread from one person to another through sexual activity. Abstinence, which refers to the choice to postpone or avoid sexual activity. Faithfulness in sexual relationships, and healthy pregnancies. CSE is not currently taught in Kazakhstan schools, and that fact is reflected in youth statistics related to sexual and reproductive health. Fewer than 1 in 10 teenagers in Kazakhstan can correctly answer basic questions about HIV and AIDS. Only about 1 in every 3 teenagers in Kazakhstan knows that condoms can prevent both STIs, sexually transmitted infections, and also pregnancies. Almost half of teenagers in Kazakhstan are unaware of the consequences of STIs. And the consequences of STIs can be extremely severe. Untreated HIV and syphilis infections can both result in death, and syphilis can cause permanent damage to a person's eyes, heart, and brain. Another STI, the human papillomavirus, is responsible for all cases of cervical cancer and can also cause cancer of the throat and penis. And chlamydia and gonorrhea, which are 2 other STIs, can lead to infertility in both men and women. So these infections can prevent a woman from being able to become pregnant when she wants to be, and can prevent a man from being able to impregnate a woman. Almost half of teenagers in Kazakhstan are unaware of the risks of unsafe abortions. And by unsafe abortions, I mean abortions that take place outside of a healthcare facility. And these procedures can result in bleeding, infections, and damage to a woman's reproductive tract that can keep her from being able to have pregnancies in the future and can even result in her death. One of the reasons that parents often object to having CSE in schools is that they incorrectly believe that if we teach young people about sex, they will start having sex earlier and they will engage in behavior that is more promiscuous than they otherwise would. And this is absolutely not the case. Young people who receive quality CSE actually start having sex later on average and have fewer sex partners than young people who do not receive this education. Furthermore, many young people in Kazakhstan are already sexually active. About 1 in every 3 teenagers in Kazakhstan is sexually active, and among them, the average age of first sexual intercourse is 16.5 years. 44% have had multiple sex partners. 1 out of every 6 sexually active teenage girls in Kazakhstan has been pregnant. 15% of sexually active teenagers in Kazakhstan have had a symptom of an STI in the past 12 months, and over 60% of those did not seek medical care. This is extremely concerning because most people who have an STI do not experience any symptoms. So that 15% is very likely a fraction of the true portion of sexually active teenagers who has an STI. And why does this matter? Well, the adolescent pregnancy rate in Kazakhstan is 36 pregnancies per 1,000 girls. This is 6 times higher than the adolescent pregnancy rate in high-income countries. And these pregnancies often disrupt young women's education, reduces their economic potential, results in early marriages, sometimes end in unsafe abortions, and sometimes even result in infant abandonment. And none of these things ever needs to happen. Another issue related to a lack of sexuality education is infertility. The infertility rate in Kazakhstan is 17%. So what that means is about 1 out of every 6 couples in the country cannot achieve a pregnancy when they want to. The reason for this is in part high rates of untreated STIs and high rates of unsafe abortion. In addition, Kazakhstan has high rates of cervical cancer and HIV. And you may recall a minute ago I mentioned that cervical cancer is always caused by an STI called the human papillomavirus. In Kazakhstan, the rate of cervical cancer is about 4 times higher than it is in the United States. Cervical cancer is often deadly, and it is highly preventable. As far as HIV is concerned, worldwide, new infections of HIV have decreased by about 23% since 2010. In Kazakhstan, new HIV infections have increased by 40% during that same time period. And because most new HIV infections in Kazakhstan are transmitted sexually, this is another issue that can be addressed by better educating young people. Finally, teenagers in Kazakhstan are learning about sex from the wrong places. Teenagers consistently report to researchers that they learn about sex from social media, from the internet, including pornography, and from Western television shows. So many of these young people are getting information that is not credible from sources that promote values that are very different from the values that we hope to promote in young people. One of the most important things that young people learn about in CSE is birth control. Birth control is an incredible tool that empowers women. It allows women to be able to decide whether to have children, when to have children, and how many children to have. It allows young women to be able to complete their education, enjoy successful careers, and earn a far better living than women who have children earlier in life. Birth control also provides economic benefits for families. Women who postpone childbearing until at least their 20s earn far more money over the course of their lifetimes than women who have their first child before the age of 20. This allows women who postpone pregnancies and their families to enjoy higher standards of living. Birth control also allows couples who are struggling financially to avoid pregnancies. And because financial hardships often result in problems within marriages and families, birth control use can help promote healthier marriages and families. Birth control also provides economic benefits for society. When women are able to earn more money, they are able to contribute positively to the economic health of their communities and of the country as a whole. Birth control is good for the environment because it prevents pregnancies that are unintended. Because every additional person on the planet increases the total environmental burden on the planet, preventing unintended pregnancies is an important way to help protect the earth. Birth control use also results in fewer maternal and child deaths. It literally saves lives. And this is because birth control enables women to time, space, and limit their pregnancies in a way that helps ensure that those pregnancies are healthy. Experts generally recommend that women become pregnant no sooner than the age of 20, no later than the age of 39, that they have no more than 5 children, and that after they give birth to one child, they do not become pregnant again for at least 2 years. And the reason for this is that maternal and child health outcomes are much worse when pregnancies occur too early or too late in a woman's life, when they occur among women who have 5 or more children, and when they occur too close together in time. For example, a child who is born 2 years or less from the birth of an older sibling is 60% more likely to die before his or her first birthday than a child who is born at least 3 years after his or her next oldest sibling. In addition to helping to prevent maternal and child deaths, the timing, limitation, and spacing benefits of birth control also help to ensure that children who do survive are healthy. So if birth control is so great, why don't more women use it? Well, many women are unaware of the benefits of timing, spacing, and limiting pregnancies. Many women incorrectly believe that they are unlikely to become pregnant. In fact, a woman who is between the ages of 18 and 44 has about an 85% chance of becoming pregnant in just 1 year if she's engaging in sexual intercourse without using birth control. And both of these issues are things that can be addressed through education. Some women do not use birth control due to a lack of availability, cost, or stigma. Some women in Kazakhstan cannot consistently obtain the method of birth control that they prefer. Many women are unable to afford birth control or struggle to afford birth control. And some women are embarrassed to purchase birth control or to talk to their doctors about it. And finally, misconceptions about the side effects and health risks of birth control are very common. Many women incorrectly believe that some methods of birth control are dangerous or that they will make it more difficult for a woman to become pregnant when she wants to be. If a woman has been taking birth control for the past 10 years and she stops taking birth control today, she can become pregnant again almost right away, just as easily as if she had never taken birth control in the first place. Modern methods of birth control are extremely safe and they do not interfere with long-term fertility. Now, there are some women who should not use certain methods of birth control. For example, women who are over the age of 35 and smoke cigarettes should not take birth control pills containing estrogen. But for most women, birth control is much safer than driving in a car and much, much safer than pregnancy. This chart shows you the risk of death per 100,000 from different things. The bar way over on the far left shows you the risk of a woman dying from pregnancy or childbirth in Kazakhstan. And that risk is about 10 deaths per 100,000 live births. The next bar over shows you the risk of a woman dying in a traffic accident in Kazakhstan. And that risk is about 7.2 deaths per 100,000 women. The next bar over shows you the risk of a woman over the age of 35 who does not smoke dying from taking birth control pills. That risk is about 3 deaths per 100,000 women. And finally, that tiny little bar over on the far right-hand side shows you the risk of a woman under 35 who doesn't smoke dying from taking birth control pills. And that risk is 0.06 deaths per 100,000 women, which works out to be about 1 death in every 1,667,000 women who takes birth control pills. So what that means is a woman who's a non-smoking woman under the age of 35 is about 120 times more likely to die from a traffic accident and about 167 times more likely to die from pregnancy or childbirth than she is from taking birth control pills. This is important information that young people should learn so that they can be healthier and have more control over their lives. In closing, CSE should be taught in schools because it can help secure a better future for young people in Kazakhstan. CSE is a simple way to be able to help make major progress on a variety of important issues. CSE in schools can help ensure a later onset of sexual activity among teens, fewer sexual partners among teens, fewer teen and unintended pregnancies, decreased rates of STIs, lower rates of infertility, reduced rates of gender-based violence. In fact, the United Nations Educational, Scientific, and Cultural Organization, United Nations Population Fund, and UN Women all consider CSE to be a critical tool in combating gender-based violence. CSE in schools can also help ensure healthier pregnancies, fewer maternal and child deaths, a healthier economy, and a healthier environment. And I apologize, I should have said in the first place, I'm a public health professional from the United States, and my focus is sexual and reproductive health. And with that, I want to thank you for your time, and the next few slides are the list of references that I used in creating this presentation. Thank you very much.